Hello and welcome to our DPI COVID-19 update, where we'll be talking to Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister, and thank you again for speaking with us. Let's just get right into it. There has been renewed interest in the COVID-19 vaccine globally. Can you give an update on, in terms of the latest developments in terms of the approval and production?
Well, thank you very much for having me once again on this program. Vaccines, of course, is generating a lot of interest because over the last 2 weeks, we have seen the release of Pfizer's vaccine, which is one, that would use an ultra-cold chain, and that is creating some logistical problem. And Moderna vaccine. Both of these are using a totally new way of making vaccine. And it is generating a lot of interest. So both of them have applied for what is called emergency authorization use. They've sent that request to the U.S. Food and Drug Administration, and they're hoping that they can get permission to go ahead sometime in December. I think the estimated time for that approval would be sometime around the 11th or 12th of December. And once they have that, those vaccines would be rolled out across the U.S. I think from Pfizer, they have said that they are going to do 51 million doses by the end of the year. So let's see what happens. In addition to that, you would know that there's another vaccine that was released, the results of which was released this morning, and that's the AstraZeneca University of Oxford vaccine. Now, they have been able to demonstrate that with 2 doses, they're reaching at least 70% efficacy, which is a little bit short of what Moderna and Pfizer has released, because in both cases they're now saying with their final results that they're close to 95% efficacy. But with AstraZeneca, what they have also noticed with the preliminary data that came out is that if you do a small first dose and a larger second dose, that the efficacy would go up by 90%. So this is certainly promising, but we'll await more information and to see how, what would come out of the more detailed studies and the data that would be available. What we should also note is that this particular vaccine by AstraZeneca is one where you do not require a cold chain, so it would be easier to use. And the normal things that you would do with a vaccine, and with the existing infrastructure that we have, we can easily distribute that. So that's showing some promise in that area. So we'll see how, as we get more information on AstraZeneca vaccine, what happens.
Okay, Minister, thank you for that. So can you please talk us through the process from when a pandemic is declared to the production of a vaccine?
Well, it depends on the novelty of the pathogen. In this particular case, we have seen the discovery of this new virus sometime in December last year, and within a year, a lot has happened, because the scientists have been able to decode the genetic structure of the virus, be able to understand how it infects the body, the human body, how it infects the cells, how it replicates, and have used that knowledge to develop a set of tools to prevent infection. Not only prevent infection, but interrupt the life cycle of the virus. And they have come up with various ways of making vaccines. As you know, there are probably about 200 and something candidate vaccines that are being developed. Many of them are in what is called preclinical trial, and we have those that are already in clinical trial. including the three that we just mentioned, the Pfizer, Moderna, and AstraZeneca, having completed now the third phase clinical trials. And we'll see in the next couple of weeks and months more vaccines that would be completing the phase 3 clinical trials. So we'll have lots of options to work with.
Minister, you had previously assured the nation that vaccines would be secured through the COVAX facility. Can you give us an update on the development on a specialized team of medical professionals who would roll out the vaccine?
So COVAX is a global body that has been established to assist countries in terms of procuring the vaccine and to ascertain which ones are safe and so forth. So they have a team of global experts that are evaluating types of vaccines, use, countries' readiness, and so forth. We are part of that mechanism, and we will receive vaccines for 20% of our population. And in the first phase, we will get at least for 3%, which would go to the frontline workers, and then another 17%. Anything beyond 20%, then the country would be required to purchase those. So that's at the global level. At the national level, we are in the process, and we have already begun in some respects, to set up mechanisms to roll out a vaccine when we do get one. And this involves, one, doing an assessment of our current cold chain, the infrastructure that we do have, what we'll need to put in place. So we have made that assessment. We will have to make some infrastructural adjustment to some of these sites, and those plans are already in train. In addition to that, we'll need new equipment in terms of to keep a cold chain. And if we are going to go with, say, the ultra-cold vaccine, then it would require some additional freezers. That would be at -80. So those are the kinds of preparations that we are currently doing. And we have different people with those skill sets that are working on those things. In addition, as we roll out vaccines, we want to train our staff to be able to do this. And we have experienced staff in the field who has, over the years, been doing vaccination. You would know that our vaccination program for children is quite robust. We do close to 18 antigens that we do on a yearly basis. So we have a number of persons around the country that are already trained to do vaccination. They know how to keep records, they know what to look for, and everything else. What we are now going to train them on is basically the anticipated use of the COVID vaccine. There are different types that can become available, and what it would require to move them around, to store, what kinds of side effects to look for. We are developing a completely new set of forms to monitor and so forth. So that work is also starting, and we are hoping to start training maybe in another 2 weeks or so. And the first set of training would be started then for these workers, and then we'll roll out to almost everyone who would be involved in the administering of this vaccine. So the work has already started, but we will name a set of persons who would be part of the National Vaccine, COVID-19 Vaccine Committee, and who would monitor and oversee all the preparations regarding the rollout of a vaccine.
Earlier in November, the FDA would have approved remdesivir, but now the World Health Organization has issued conditional recommendations against the use of this drug. Is there some tussle on the international stage?
Not really. What has happened, a number of medication which was thought to be effective against COVID, when you do what is called clinical trials, you would get a better understanding whether it's working or not. So we have had in the past drugs like hydroxychloroquine, which was used in a lot of countries, but then when you do the clinical trials, it, the results that one would have expected, you didn't get them. And because these clinical trials are the most accurate way of judging whether a medication works or not, the findings from these clinical trials are then incorporated into guidelines. So it's the same with remdesivir. There was a study that was done for remdesivir in the United States, and that shows that for a limited amount of patients with certain conditions, that it would help to reduce hospital stay. So if you were going to be in the hospital, say, for 15 days, it would probably bring that down to 11 days. And in that limited subset of patients, it works in terms of reducing hospital stay. So this is known. The WHO then had a trial called the Solidarity Trial, which included thousands of people in various countries around the world. And so they had many more people involved in this study, and then the findings from this study did not show any significant change. And that is why the WHO itself is saying that they're not recommending this particular medicine. So it is for countries to decide what it is that they will put in their guidelines. A lot of clinicians still believe that there's a role for remdesivir within a subset of patients, while others probably think that you should discontinue it. We have a local guidelines committee dealing with the treatment of COVID patients, and they would make those decisions as to whether we continue to use remdesivir or not.
Okay, and they haven't given you an update on that as yet?
No, I guess they'll have to meet and based on the new findings that they're seeing to make those decisions.
So let's talk a little bit about the COVID-19 enforcement measures. I know over the weekend, more than 100 persons would have been arrested for breaching the protocols. What are some of the plans for increased enforcement as we approach the Christmas season?
Well, again, we want people to remain safe. We know that around the holiday season, a lot of people believe that, you can drop your guard as it regards to COVID. And that would not be the right thing to do. You have to ensure that you're abiding by the measures, ensuring that you're wearing your mask, ensuring that you're doing the sanitization, keeping social distancing. All these measures are preventative measures that are geared to help people stay safe. Unfortunately, we have seen that a number of persons are bent on breaking these rules, and they're not only endangering themselves, they're putting other people at risk as well. Because, as you know, with this disease, a lot of people are asymptomatic, and sometimes they themselves don't know whether they have the disease or not, and they can infect others. So we're trying to get people to understand this, and hopefully, as these exercises are rolled out around the country, that more people would be in compliance. I think if people would look at their television and see what is happening in other countries, you would see in the United States, for example, thousands of people every day are getting infected. You would see in Europe similar things are happening. And you now have in some countries what is called a second wave of infection, or in others a third wave of infection. So if we want to protect ourselves and our country, then we have to take these precautions. And while Operation COVID Curb, we have been working and trying to educate people and sharing out masks and so forth and getting people to comply. In some cases, you also have to use the more stringent measures, which would include, if people are not abiding, to take them to court and to get them to understand that this is serious. In addition to those individuals, we have also been focusing on a lot of businesses, because there are businesses who have been non-compliant. And the Secretariat has written to these businesses, and in fact, to date, we have sent letters to about 42 different businesses, and again, we are trying, first of all, to get them to understand that what they're doing is wrong and that they need to follow the COVID guidelines, and we give them a period of time in which to be in compliance. If they continue to breach these guidelines, then it would leave us with very little option but to, to take more drastic measures. So we don't want to take those measures, but we want to work with businesses to ensure that they comply. And that's our first objective. So hopefully we'll get good sense to prevail with everyone, and all of us would be able to do our business in the right way, following the guidelines. So let's see what happens.
Let's turn our attention to St. Cuthbert's Mission. Can you give an update on the cases coming down? What's the numbers like today?
Well, St. Cuthbert's Mission, again, we have a team there. We were hoping that, within a 2 to 3 weeks period, we would have seen a reduction in cases. So we started with, I think, about 260-something cases in St. Cuthbert's Mission. As of today, we are down to about 71 cases. And I guess by the end of the week, we should see a further reduction. So these are people who would have been under observation for the last 5 to 10 days. Once they meet 10 days and they remain asymptomatic, then they're discharged. So I expect that even with this 71 active cases that we currently have, that we'll see a reduction by the end of the week. We are also having, apart from St. Cuthbert's Mission, we are now seeing a spike in Siparuta in Region 6. And we currently have about 30 cases there, so that's an area that we'll have to now focus our attention and monitor more closely. Over the last 3 to 4 days, we've had medical teams from Region 6 going into Oriala and Siparuta, working with the community, talking to the village council, trying to get them to understand the precautionary measures that should be taken, and also doing a lot more testing. So I would expect, as we get back the test results for people in those communities, maybe we'll see a slight increase in the next coming days.
Would you say if the numbers go up in that community, it will be placed on a lockdown?
We'll evaluate and we'll make that decision later on.
Thank you so much for your time today, Minister. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.